All right, so in order to understand what the issue is with dating a patient, it's important to understand that the reason why you have boundary rules that preclude you from dating a patient is because there's a huge power differential between the doctor and the patient. In essence, as a doctor, you can tell somebody to take their clothes off, and you can touch them in places that nobody else can or should be able to touch them. So because you have that power, you're not supposed to abuse that power for your own gratification by dating the patient. So what sort of things, so it's obvious that you shouldn't date a patient. So these factors, though, get kind of tricky. So for instance, if you started first dating the patient as opposed to starting them as a patient and then start dating them, if you started first treating somebody and then started dating them, that's worse. So your discipline is going to be worse. If you had sex with the patient, but all the sex was outside the clinic, that's better than having sex in the clinic or having sex in particular while treating the patient. That makes it much worse. And if you had sex with multiple patients rather than just one patient, that makes it worse. And interestingly enough, a lot of times when I deal with doctors that have been accused of a boundary crossing with a particular patient, almost always I'll ask the follow-up questions, have you had sex with other patients? And many times the answer is yes. And many times the doctor is very ashamed to talk about it and will initially say no. But I'll ask the question multiple times in different ways and eventually get the information out. And so this is a moment in time when you have discipline. You need an attorney to help you. You need an attorney that's going to ask those pointed questions. And you need to understand that if you have had sex with a patient, it's better to actually get it all out in the open if it's been multiple patients, because if you take your discipline just on one and then the other one pops up, the board will take additional discipline on you for the other parties. Whereas if it's been multiple patients, you just come clean with the board on all of them, and it's likely that your discipline will be less severe.